It was something I've done 100 times, probably 1,000 times. And it just so happened that this one time broke and I was on the pool deck.
Coming up, a fall from 22 feet and a recovery that is nothing short of remarkable. We'll take you inside Brock Martin's journey from trauma and surgery to walking back through the doors of the University of Kansas Health System. Good morning, I'm Jessica Lovell. In a split second, a 22-foot fall and injuries that changed everything. Brock Martin was rushed to the hospital with multiple fractures and a collapsed lung. Now, after surgeries and months of rehab, he is making an incredible comeback. We'll get to his story here in a moment, but before we get to that, we're going to go to our morning rounds to focus on nursing. In just a few weeks, our health system will celebrate the nurses who care for patients every single day. And many organizations across the country are already beginning those celebrations this week. Joining us this morning to talk about the impact nurses have on patient care and why nursing is so essential to the quality of care that we provide is Nursing Director for the University of Kansas Health System, Tori Butler. Tori, good morning. How are you?
I'm good. Thank you, Jess.
Good to have you today. Our nurses recently received Magnet with Distinction, which is a very high honor. So for people outside of the healthcare world, what does that mean?
Yeah, Magnet with Distinction truly is one of the highest honors a nursing organization can receive. It recognizes not only the excellence in nursing care, but also the outcomes that the teams achieve for patients every single day. What makes it most meaningful is that it reflects not only the expertise, but the compassion, the innovation, and the teamwork for our nurses across the health system. But for our patients and family, it means that they're receiving highly educated nurses and that are using evidence-based practice and advanced technology in constant collaboration to deliver the very best care. One of the most fun things is only a very small % of hospitals in the nation receive this designation.
Such a proud moment. And I never get sick of seeing that video of you all cheering and getting excited about it. So well deserved. And nursing has, of course, changed so much in recent years. What qualities and skills do nurses need today that might not have been so critical maybe a decade or more ago?
You know, I'm going to show my age just a little bit. I became a nurse over 20 years ago, and I reflect back on nursing then and nursing now. And today requires an incredible combination of not only clinical expertise, but the adaptability and the communication skills overall. Healthcare has become more complex, and nurses are caring for patients with higher acuity levels, while also adapting and navigating rapidly evolving technology and treatments and evidence-based practice. So nurses today need strong skills and not just critical thinking, but that technology, that collaboration, and honestly, leadership. It's the importance. But let me take a step back. There's only one thing that probably I can say without a doubt that hasn't changed over these years in nursing, and it's that human connection. Patients still need someone who can make them feel safe, who can make them feel heard and cared for during their hardest moments in their life. And that's something, if you ask me in another 10 years, is a piece that I would hope that hasn't changed either.
Yeah, I don't think that'll ever change. And that leads us right into this next part of the story, because nursing, as we know, is a skill. You've mentioned that, but it requires a lot of heart. And we love highlighting those moments in our nurses. We previously shared a dance party that took place for one of our cardiac patients. We've seen nurses cheering patients along with bubble parties and all sorts of touching moments here in the halls of the health system. What do we know about how that compassion affects outcomes, Tori?
I love those stories. So we know that compassion truly impacts healing. Research continues to show us that when patients feel connected, they feel supported, and they feel cared for emotionally and physically, it can improve that trust. It can reduce the anxiety and even positively improve the recovery and the outcomes. It's those moments, whether it's the dance party that we just showed there or cheering someone on, that helps to remind our patients that they're more than just a diagnosis. Our nurses bring both extraordinary skill and incredible heart to the bedside every single day. And those are those connections that matter.
Yeah, and we rarely videotape them. There's so many going on you'll never hear about, and no one ever gets the credit for it. It's just really, really quite incredible. Tori, thank you so much for being here. I want you to have a great day, great week. Thank you to all of the nurses here at the health system.
Thank you.
Well, May is Trauma Awareness Month, a time to recognize the life-saving work of trauma teams and the patients who fight their way back after devastating injuries. Today, you'll meet a young man who is a teacher turned trauma patient. Here's Alexis Del Cid with his story.
Good to see you again.
Good to see you. Thank you.
How's it going?
To see him now, you'd never know what Brock Martin survived until you see the pictures and watch the videos his family took when he was in the hospital.
It was something I've done 100 times, probably 1,000 times. And it just so happened that this one time broke and I was on the pool deck.
Brock was 22 feet up when a safety strap broke. Brock came crashing down onto a cement pool deck.
I tried to pop right back up, thinking that it was just a broken nose, maybe a couple teeth.
It was far worse than that.
And I looked down at my knee and saw that something was wrong with my leg and laid right back down and was told not to move from that point on.
He was rushed to the University of Kansas Health System. X-rays revealed facial fractures, broken ribs, a collapsed lung, broken toes, and his kneecap was shattered.
Oh, this was really bad. And it was probably a week, maybe 2 weeks later that it really hit how bad it actually was.
You feel how much more stable that is?
After 2 surgeries, one for his face, the other for his knee, rehab continued at home.
Trying to relearn how to walk, relearn how to put pressure through my joints, biting, chewing, things of that nature. So it's kind of like those two kind of molars.
Now, 6 months later, he's checking in with a member of his care team. So grateful to be through the worst of it all, knowing he has more work ahead.
Let's just take that plate out and see what it does for you.
Cool. I don't want to say I'm all the way back, but I'm really close, and I'm thankful.
In studio this morning, along with his partner, Olivia Nunez. So great to have both of you here.
Good morning.
And doing well.
Yeah, thank you.
Good to have you. We also have Brock's ENT surgeon, Dr. Omar Karadaghy. Thank you for being here.
Thank you for having me.
So Brock, let's start with you. When you see those photos and the video from the hospital, just what goes through your mind now?
Just how incredibly thankful and lucky and blessed I am to really be here. Having the team that I did really, really made a lot of difference, made a huge difference. Just the speed, the care, the recovery. She mentioned how compassionate the nurses were, and that rang true almost every single day in here at KU, and I'm just beyond thankful.
So lovely to hear. You mentioned you thought that this was minor at first. I would imagine there would be some shock involved when you fall from 22 feet. How long did it take you to realize how serious this was?
Probably about the time I arrived in the ER. Like it said, I mentioned that I just popped right back up. I did. I tried to get right back to work thinking I could just wipe off a bloody nose and move on. And then when I tried to step and walk and move my leg, I had to sit back down. And the entire team that I was with rushed around me and told me to kind of sit back down, lay down. And then it was when I got here to KU and they started to ship me into X-ray and CT and all of that stuff that I was like, oh, yeah, okay, this could be really bad.
This is a big deal.
Yeah.
Olivia, you get this call about this accident. Did you know how serious it was? When did you learn? What were you learning as you went?
So I didn't know how serious it was. No one wanted to scare me too much on the phone. So I knew that he had taken a fall, but the message I got from him off of his watch that he was messaging me off of in the ambulance on the way over here, it definitely hadn't hit him yet either, because I had a little fall. I'm in the hospital, you don't have to come, everything's gonna be okay.
A little fall.
And it started the journey of 5 or 6 days in the hospital just to start.
That must have been a sight for you when you saw him and realized this was going to be a long road ahead.
Yes, absolutely.
Dr. Karadaghy, we saw the image of Brock's face. Walk us through what we're seeing and how complex were those injuries? What are we seeing here?
Sure, yeah, absolutely. So you can see that in the middle third of his face, the area that we call a mid-face, there's been a number of injuries, and you can see on the right side first, you have a fracture line that's going from one side of that maxillary bone to that nasal region. You can see that his nasal bones are fragmented and fractured, and you can see his teeth, that tooth right there is fractured. And then you can also see on the other side, on the left side, there is a fracture line going from his eye socket to the other maxilla. So that all suggests that there was some pretty significant amount of force that happened on that mid-face region that caused those kind of fracture patterns, because they span some key buttresses in our facial region.
Brock, you're kind of smiling at this picture. What are you thinking when you see your face, and what does this signify to you?
He had suggested that there were lots of traumas and injuries to my face, and I grew up playing sports, and so I've shattered my occipital lobe twice, one on each side. And so I heard it was a facial fracture, and I was like, oh, cool, I've been through this before. And then I got to meet Dr. Karadaghy, and he kind of walked me through what happened and said what had actually happened. And I was like, oh, this is a new facial injury for me. Like, let's add it to the list.
Add that one to the list for
Yeah.
sure. Check that box. What kind of pain were you in?
It was hard to tell. I had a lot of medication at the time, but I didn't feel a whole lot of pain through my face at all. It was more just my body trying to recover and trying to relax. I think the more pain came once I was post-hospital, trying to recover with just muscle fatigue and relearning how to walk and eat and do everything again.
Well, we asked trauma surgeon Dr. Jennifer Hartwell, when someone comes in to the hospital with complex injuries like Brock did, how do doctors determine what to focus on first?
We sort of have a very systematic way of approaching patients who come in after a trauma. We even use the letters A, B, C, D, E. So the first thing we address is their airway and breathing, then their circulation, disability, so looking for any injuries, and exposure. We do have to completely expose the patient so we can see any injuries, and then rapidly cover them back up and keep them warm. But that's a very traditional and used every day in trauma to go through the ABCs to address injuries in order, the things that are most life-threatening first.
Brock, what was the most challenging part of the recovery?
Patience. I'm not a patient person, and I was lucky enough to have a great team here at KU, and they assured me that everything went smoothly and everything was going to rebound really well. And to me, really well is a few months, a few weeks maybe. And so I was ready to go. And as soon as I got the okay from Dr. Karadaghy and my orthopedic team, I was back in physical therapy, working probably way too hard to get back to normal.
Olivia, how were you able to step in and help Brock with his recovery? What was your role?
Yeah, I was there since I got to the hospital when it happened, all the way through. I slept in the chair the whole time he was in there. Luckily I have a master's of social work, so I was able to focus a lot since we were so confident in his doctors taking such good care of him, of what next steps were once we left the hospital, of making sure that his mental health was okay, making sure that he was honest with himself about what pain he was in. We had to explain the pain scale to him a little bit, of that it's not the worst pain anyone's ever felt before, it's his pain. So making sure that his mental health was doing well on top of everything, taking some time to be able to get us back upstairs to his bedroom because he had a flight of stairs to go, so we spent about a month and a half on a couch just waiting for him to get strong enough to be able to get back up there.
What were you doing up there, might I ask?
I was setting up for an event for a company called Quixotic. They're a performance troupe here in Kansas City, and I was setting up a backdrop for like a photo opportunity moment. And I was on top of a planter box with one of our other coworkers, and I was tying up some straps, and those straps just snapped. And
you said you've done this hundreds of times.
Yeah. And I grew up in scouting, so knots and heights was really familiar with me, so I was very confident and very comfortable up there. It just so happened that the very last one I tied on the entire banner happened to be the one that broke, and momentum carried me backwards.
Kind of a freak accident,
yeah,
if you
absolutely.
will. So I have to ask, are you afraid of heights now?
No. I'm not going to say I'm ready to jump back up there and tie another knot, but if it meant climbing up a ladder to do something, sure, let's do it.
Okay. Dr. Karadaghy, when you hear someone fell 22 feet, what are your concerns? We've been talking about the face a lot. What about the neck?
Yeah, the neck is an incredibly important part of the body, as you can imagine. And we also have, not quite the ABCs, but we also have sort of an order of increasing severity of injuries that can happen that we're looking out for. And really the most imminent one is the windpipe of the neck. And so we're always looking, and that is incorporated into the trauma surgeon's ABCs, looking at the airway and the breathing and that. But that's one of the main ones. The second most important structure, I would say, is the spine. And so really having a solid trauma team that we can work with to make sure that these life-threatening critical injuries are ruled out, that allows us for us to get involved and do our part of the job.
So what other hurdles did you have to overcome in Brock's face injury?
With his face injury, you know, his fracture pattern is very classic. It's called a Lefort fracture pattern. And a Lefort fracture pattern is a system of fractures that span important facial buttresses, and these are important for his function. And the function that we're most concerned with his midface fractures is his jaw. So being able to get his jaw healed in a way that allows him to get back to a normal diet is of utmost importance here. The other important thing about these Lefort fractures is that our bony structures define our facial width and our facial height, you know, the things that make our faces unique. So being able to get the bones to line up in a way so that his face is not indented on one side or asymmetric or more asymmetric than what is normal, that's really our priorities here.
Brock, tell us about physical therapy. How much did you need physical therapy? How much?
I needed physical therapy. I'm still currently in physical therapy. It's been a journey, 3 times a week since August. Just trying to build range of motion again and strength back in my leg, building confidence back in movements and in the ability to do things that I normally would. So it's been a lot, but I enjoy the challenge and going at it.
How was it like getting back to work as a teacher? On the ground, a little safer on the ground.
A lot safer on the ground. It was great. My students were really cool about it. My whole administration team was really cool. I didn't miss a single day, which is a testament to our care team here, or excuse me, my care team. It was kind of business as normal, and it felt good to have a routine again.
I bet. Well, we asked Dr. Hartwell about trauma care and how it has continued to improve over the years.
There's lots of exciting new things that are happening in medicine over the last 15 years since I started practicing. One of them is that we've changed the way that we resuscitate patients. We used to give a lot of IV fluids, and now we give a lot more blood. And in fact, we give whole blood, which is a little bit newer in the civilian world. We learned from our military colleagues that giving fresh whole blood really helps our patients have the best outcomes. So we're starting to do that more and more here. We do that here at KU. We give whole blood. Another thing that we're doing is less invasive things. So as our interventional radiology colleagues have become more and more advanced with their techniques, sometimes we're able to spare patients a large open surgery and manage their injuries with less invasive means like interventional radiology. Sometimes we're even able to use robotics, a little less in trauma, but we are starting to try to do more and more of our surgery minimally invasive. So with very small little incisions instead of big incisions, which helps patients with their recovery and pain.
Be sure to ask your questions. You can use the chat on YouTube or Facebook, or you can email the Medical News Network. That information is there on your screen. Brock, we saw those early videos of you in the hospital. What do you remember about those first few days lying there? I mean, just kind of about what's next, what's coming, getting back to work. What was going through your mind?
That's a tough one. Because I was so comfortable with the care team here at KU, everything was so transparent. I knew the next steps. It was more or less myself and my own mental battles of, okay, things aren't going to be as the old normal. It's going to be a new normal. How can I adjust to that? How can I grow to that? It was just a mental battle, really.
Well, that's why I want to bring Olivia, because you were talking about all the physical aspects of being a caretaker, but how were you able to help him put into perspective that mental health and the emotional health to keep things positive?
It's kind of easy with him. It was easy to help with everything that he needed because he's the person that jumps up for everybody all the time. It was an opportunity for me to give back all of the kindness that he's shown everyone around him all the time. So no matter how many times I was trying to make mushy meals taste good for him when he could barely eat, it was easy to do because it was hard to have him not be positive. He was positive through almost all of it.
How important was Olivia there by your side, just having a supportive caregiver during this type of recovery?
Crucial. If it all happened again, I would do it the exact same way with Olivia next to me, because she was so positive and so she kept my spirits in the right direction. There were some days where I thought it wasn't going to be normal ever again. I wouldn't be able to play soccer, run around, get down on the floor with my dog. And Liv was really, really good about refocusing my mind about the positives of it all. Like, I'm alive, I can do things, it's just going to be slow. So she was instrumental in my recovery.
You mentioned patience was one of your tougher things to overcome.
Yeah.
What was it like learning to walk and chew again and all those things?
It was difficult. I haven't ever been a slow individual. I've wanted to do everything as fast as possible. Efficiency is kind of the thing I harp on with my students all the time. So being inefficient in walking or eating or chewing was a real big mental battle for me. And it just took a lot of time and patience. I remember the conversations I had with my PT here in the hospital, Lib, of just having to redo everything and relearn everything. It's going to be a slow process. Babies don't learn to walk until they're much older. Here I am doing it again.
Starting over. Dr. Karadaghy, on that note, what does long-term care look like? Is there anything you're watching out for as time goes on for Brock?
Well, the further out we get from the injury, the less I worry about things for him. I mean, the biggest things that I'm looking for are his teeth sitting together? Is he getting back to a normal function? And then we start talking about, is he happy with how his face looks, or is there anything that looks different than what it was? And as time goes on and he feels more comfortable with the care, then more and more the answer is no, there's not much more that we need to do.
So I'm just curious, do you look at photos of before and after? I mean, when you're trying to look and get his face, rebuilding a face, do you look at photos of him from before to kind of get an idea of where you're heading?
Yeah, absolutely. It depends on the extent of the injury too, and certain cases where the bone is shattered more or less, then yes, looking at pictures, if they can pull some up on the phone, is extremely helpful. And Brock's particular case, because he's young and he's healthy, and because his bones were relatively in good shape, they were able to tell me where they needed to go more than anything else, and so that was very helpful.
And you talked about being honest with your doctors about your pain. Why is that so important for someone going through recovery? And I think Olivia really helped you with that too.
Yeah, absolutely. Being honest with your pain is crucial, because they can't help you if you don't tell them. And that was a big thing I learned the hard way, really, and Liv had to reframe it for me of, they can't make me better if I don't tell them what's wrong. And so I thought everything was going to be great and heal on its own in its own time. And, with my nurses at the trauma floor and with Liv, they kind of rephrased everything to like, hey, they're here to help you. Let them help you. Tell them your pain, tell them everything. And so being as transparent as they are with me, I needed to do the same with them.
Dr. Karadaghy, from a doctor's perspective, what does it mean to see a patient like Brock walk back through the doors after 6 months out?
For us, it's a huge win, and it means everything for us, because many times we see things not going in that direction, and we see people healing in worse ways, and those are very challenging situations. Those are very difficult for us to see that we've done our best, and unfortunately we haven't been able to rise and meet expectations. That's not to say this has been a slam dunk case. I mean, Brock has certainly gone through the ringer, and he continues to deal with some lasting sequelae from that injury, but to see overall how far he's come, it means everything to us.
Well, we asked Dr. Hartwell, what should people know about trauma care and how quick treatment can impact outcomes?
It's sort of a loose concept that the things that are the most life-threatening are the things that need to be addressed within that first hour. So bleeding, making sure patients have enough oxygen, And so those are things that if they aren't addressed quickly, and the hour is sort of a loose hour, but the point being that those are things that need to be addressed immediately in order for the patients to have the best outcomes. And we know that patients who are injured, the quicker they can get to a higher level trauma center, the better the outcome that they will have.
Olivia, what type of advice might you have for other caregivers who are helping a loved one go through a trauma like you've helped Brock?
Yeah, I think some of it has to do with knowing also that to take care of yourself as well. I think that we did a good job talking back and forth about that it not only affected him, but it affected me and his parents and kind of everyone around us as well. And we gave some time for some moments of normalcy, of him also listening to stuff that was going on in my life, or difficulties with trying to balance work and everything. So I was able to hand that back to him and not baby him through it. And I think that that was really helpful, that we were just really transparent with each other and really focused on it like we were a team the entire time. And that helped, that give and take a lot too.
Brock, what's next for you?
Back to normal. No, I had an MRI on Friday, so I've got a couple follow-up appointments still to come. But what's next for me is hopefully never having an accident like that again, and just checking in and making sure everything's good on the path.
Well, we are so glad you're doing well. Let's get to some questions from our viewers this morning. First comments from Atlas says, "You're looking good. You're a walking miracle." Tim wants to know, after a traumatic fall, what symptoms should someone never ignore? Doc, like let's say he had fallen, didn't think it was a big deal. When do you know it's a big deal?
Yeah, I mean, certainly if I would go back to those ABCs, if he's feeling like things are hard, it's getting hard to breathe, if he feels like he's getting pretty dizzy, if he notices that his strength is not quite what it was, obviously if he's noticing something about his arm or leg is not bending the way it should, these are all pretty important things to not ignore.
Some of the obvious stuff. Connie wants to know, how long does it typically take to recover when you have multiple injuries like this?
Yeah, it can be variable depending on where the injuries are and the severity, but at least from the facial fracture side, I would expect a recovery of around 3 to 4 months at a minimum.
Becca wants to know, what's been the hardest part emotionally for Brock?
Ooh, not being the same. And I know that sounds silly, but I was very much a on-the-go 24/7 person. I didn't ever really stop until my head hit the pillow. And so just emotionally and mentally wrapping my brain around not being able to do that again, and kind of being okay to sit with myself was the hardest probably emotionally for me.
So it slowed you down, whether you liked it or not.
Yep, absolutely.
Well, we want to get our takeaways from our program today, but first we asked Dr. Hartwell what the big takeaway is when it comes to trauma care.
The biggest thing I would want people to know about trauma care is that we are here for you 24/7. If you have an injury, we are skilled and trained and happy to take care of you. There's no injury too big or too small that we can't help take care of here at KU. And it's our honor to take care of any patient who is injured in any way. We'll be here for you.
Olivia, what's the big takeaway from this story?
I think that it is that especially what you spoke about with nurses, that positivity and that optimism goes such a long way in care. I think that we would be in a different spot right now if he hadn't been as positive and optimistic and kind, and to all the nurses and everyone that helped and all of his doctors. He was in the hospital wanting to ask if everyone else was okay. He was bleeding in the ER asking if me and his mom and dad were okay and how we were feeling. So I think that he never dropped that, and I think that positivity it goes so far.
Brock, what do you want people to take away from your story today?
Safety straps. Always use safety straps. No, and just being transparent with your doctors and your care team. I think that's the most important thing anybody could do in a situation like this. Be honest.
Thank you for being willing to share your story with us today.
Absolutely.
We really appreciate it. Dr. Karadaghy, what's the big takeaway you want people to get?
It really takes a village to take care of these complicated facial fractures, and so we're very fortunate here to have that support. Our facial trauma team is very robust. They're very skilled. We're all part of the AO CMF network, which is a huge global network of surgeons. So we're always learning and educating and staying up to date on the latest schools of thought. So, we are very proud of the program that we have, and we have a lot of great community partners. And to do facial trauma well, it really takes a village.
Well, we want to thank all three of you for being here with us today. Thank you so much. We want to thank all of our guests and all of our viewers for joining us today. We'll see you back here tomorrow. It was a catastrophic crash. A 22-year-old traveling back to her senior year of college. She was hit by a suspected drunk driver. She was ejected from her car and left with a severe injury. Doctors gave her one of the lowest possible neurological scores. Her miraculous comeback tomorrow on All Things Brain Health.
Subscribe to our morning medical update and open mics with Dr. Stites podcast. Now everywhere podcasts are available.